Okay, so now that we have talked about normal labor and how it should go, we're going to talk about some complications. One of the most common complications of labor is preterm labor and preterm delivery. So we're going to talk about that now. We're actually not going to talk about the effects of that on the infant until we get to newborn, but understand that what we're trying to avoid when dealing with preterm labor is a premature infant. So just some statistics to start with. Preterm birth is responsible for more complications than any other cause. In 2020, about 10.1% of births in the US were preterm. That's a lot, 10%. That's 1 out of every 10. There is a difference between preterm labor and preterm birth. Preterm labor is when someone's having uterine contractions and cervical change between 20 and 37 weeks, okay? But we can have preterm labor without preterm birth, and it's actually very common for someone to have uterine contractions and cervical change and then not deliver until after 37 weeks. There's kind of preterm birth is if birth occurs anytime between 20 and 37 weeks. There's a section we talk about with late preterm. Those early preterm babies, the micropreemies, have the highest incidence of complications. They have the lowest survival rates. They're the most likely to have long-term disability. And then there's the ones kind of in the middle where they may have pretty good outcomes eventually, but they may have a lengthy stay in the NICU. And then the late preterm, that's 34 to 37 weeks. We used to really not worry too much, and survival rates are really, really high in that group. After 34 weeks, survival rates are really good, but they do still have some complications, and they often have some difficulty with transition with respiratory. They have difficulty with feeding, may have slower weight gain. They may have greater susceptibility to infection. So there are still some risk in that late preterm section. That's 24 to 36 weeks and 6 days, okay? Low birth weight is 2,500 grams or less at birth. Now, low birth weight is not the same as preterm. We can have preterm and have a baby that's larger. We can have a full-term baby that's smaller, but there is a lot of overlap. Most babies that are 2,500 grams or less are going to be preterm, okay? Understand, though, that not every fetus is developed to the size that they should be for gestational age. And we talk about that when we actually get into newborn. We also have what's called an indicated preterm birth, and that's when a baby is delivered either because of fetal or maternal health considerations. Okay, there's something about the pregnancy that makes it riskier for either mom or baby for that pregnancy to continue. So that would be a preterm birth for an indicated reason. There are some risk factors for preterm labor, and then we have risk factors for preterm birth. Because remember, we can have preterm labor and not deliver. So the risk factors for preterm labor: a patient who's had a history of genital tract infection, colonization, or instrumentation. So if they've had any kind of surgical procedures involving the genitals, if they've had a previous instrumental birth, that increases the risk. Black American women are much more likely to have preterm labor than most other groups of women. Any bleeding in pregnancy that they don't know what it's from. So bleeding in pregnancy. A history of previous preterm birth is the strongest risk factor in the patient's history. So patient has had a preterm birth before, that means they're more likely to have preterm labor and preterm birth. Uterine anomalies. There are uterine structural abnormalities that can actually make it more difficult to carry a fetus to full term. Assisted reproductive technology is associated with preterm labor. Multiple gestation, because the uterus just runs out of room. It's thought that one of the things that may initiate labor is stretching of the uterus. So if we have more in there to stretch, then we may end up with preterm labor. Tobacco and substance use, there are several substances that are associated with increased risk of preterm labor. Tobacco definitely is. A pre-pregnancy BMI of less than 19.6 or over 30. So underweight or obese. Healthy weight and overweight women tend to have less problems with preterm labor. Underweight and obese women have greater risk. Periodontal disease. This is an odd one, but gum disease. The thought is that it has to do with the bacteria involved in gum disease. Lower levels of education, poverty, high levels of stress, later entry to prenatal care, all of those things that are associated with people who are underserved, people who live in very rural communities, people who live in inner city communities that are very poor. So all of those people who are underserved by healthcare, who are and who have more socioeconomic risk, all of those things increase the risk for preterm labor. The cause is believed to be multifactorial. We don't really know, we don't really pinpoint one specific cause of preterm labor. Now, things that make preterm birth more likely, all of those things increase the risk for preterm birth, but also living in a disadvantaged neighborhood, state, or region makes it more likely that the person will give birth prematurely. Lack of access to prenatal care, again, increases the risk of preterm birth. Familial history, if the women in the family tend to give birth prematurely, that increases the likelihood. 50% of all women who give birth prematurely have 0 risk factors. So these risk factors are not very predictive. And the one thing we're trying to prevent is the birth of an infant with immature body systems. So in the next section, we're going to talk about how to predict whether the patient with preterm labor is actually likely to deliver.